Hello and welcome to your video lecture on Chapter 20, where we are going to continue talking about the cardiovascular system, and this time focusing on blood vessels and circulation. So we'll start off with the function of our blood vessels and circulation. Their job is to carry our blood, and in carrying that blood, we are exchanging nutrients and waste products and our gases, of course, such as oxygen and carbon dioxide. We can also carry our hormones to deliver them to our endocrine glands, and we have some components of our immune system, molecules for coagulation like our clotting factors and platelets. We've got our enzymes, and of course we've talked about our nutrients, gases, and waste products. So we can utilize these blood vessels to also regulate our blood pressure by doing things like vasodilation, making that lumen open up, or vasoconstriction, making that lumen more narrow. And we can also direct blood flow. We can also kind of control this through the vasoconstriction and vasodilation. So if we want more blood flow to a certain area, we would vasodilate, whereas if we want to minimize blood flow to a certain area, we would vasoconstrict. First, let's talk about the different types of blood vessels that we have, starting off with our arteries. And we are going to have two different circuits in which we work within. We have our systemic circuit that is typically going to contain oxygenated blood within our arteries. So for instance, something like our femoral artery or brachial artery will have oxygenated blood within it, but within our pulmonary circuit, we will have the blood vessels going to and from the lungs. So our pulmonary arteries would actually carry deoxygenated blood, whereas our pulmonary veins, which we'll talk about veins in a moment, but they would contain oxygenated blood. So a little bit backwards. So as far as our arteries, we don't define it based on if they have oxygen or deoxygenated blood within it, right? We just discovered that in these two circuits above. So instead, we want to define it as a blood vessel that is carrying blood away from the heart. So you want to think A, arteries away. And we've got three different types of arteries. We have elastic arteries, such as our aorta, which would have more elastic fibers within it. Our muscular arteries, such as the femoral artery or brachial artery that we mentioned. And then we have our arterioles, which are smaller arteries that branch off of the main arteries. So these are going to be really important in figuring out what our blood pressure is by vasodilation and vasoconstriction. And that ultimately is controlling the blood flow into our capillary beds here, where we are going to exchange gases and nutrients and waste products with our tissues. And then all the capillaries come together to create a small vein, which is known as a venule, which drains into a vein. So how are we going to define veins now? They are always going to carry blood back to the heart. Now I know the V and B don't really match here unless you want to be like Dracula and say the veins carry blood back to the heart. So just trying to be creative here. But you'll see that when we look at the wall of our veins that the walls are thinner than compared to our arteries, and that's because they contain less elastic tissue and have fewer smooth muscle cells. So as I said before, small vein is a venule, and that drains into a small vein, and then into medium veins, and then into large veins. And the largest veins we have within our body would be our superior and inferior vena cava that we talked about in chapter 19 when we talked about the heart. So now let's take a closer look at the histology of our veins and arteries. If you look at these cross sections, so the lumen is here, this is the outside of the vessel, and imagine these are the walls kind of mirrored over here. So here's the inside of our lumen, and this is the outside of the vessel of our artery, and same thing here for our veins. This is the inside of the lumen, and then this would be the outside here, okay? So the innermost layer that is in contact with the lumen is called the tunica intima, and that is made up of what we call endothelium. And endothelium is really just a a simple squamous epithelium, one layer of flat cells. So beyond that layer, we would then have a basement membrane and then a lamina propria, which is just a connective tissue layer, and in an internal elastic membrane. So what that means is we've got a fenestrated layer of elastic fibers, so lots of spaces between them. That's what that fenestration means. Then if we look at the middle layer here, the tunica media, okay, tunica, by the way, just means a layer. So this layer is going to contain our smooth muscle cells, and we see that they are arranged in a circular manner, meaning they're more concentric, so that when the muscle contracts, we are able to get vasoconstriction, and that decreases blood flow. It can also increase blood pressure, so keep that in mind. And here's what vasoconstriction looks like. So this is our normal cross section. You could see here the lumen has become smaller. Something else to note is that the tunica media is thicker in an artery than a vein, and that again is because we've got more elastic fibers and smooth muscle here in arteries. That's how we're really going to get a pulse going here too. And then we are able to vasodilate, meaning we're going to get this smooth muscle layer to relax, and then the blood vessel opens up and we get an increase in blood flow, but with that extra volume we have a decrease in blood pressure. And lastly, we have the tunica externa, this external layer of our blood vessels. This is also known as the adventitia, and it's made up of connective tissue, and it varies from dense, regular, near the vessel to loose that merges with the surrounding connective tissue. And you can kind of see this in here. These vessels look like they are in an area of fat. That's why we see so much white in here with our adipocytes. So we've already talked a bit about what a lumen is. It's just that opening of the vessel where the blood is going to flow through. Now, as our blood flows through, we have these teeny tiny blood vessels that are going to help supply the actual blood vessel wall. And this is called vasa vasorum. And so this could be internal like we see here, or it could be external, but it helps supply the tissue of our veins and our arteries. So it's penetrating the wall there to do that. And here's just another image to show you the different layers. We can see here's our endothelium, that single layer of squamous epithelium. Anytime we have simple squamous epithelium in what's the word I'm looking for? In blood vessel terms, or anything having to do with the cardiovascular system, we're going to just call that endothelium. Then we see our basement membrane, the lamina propria, and then that external elastic membrane, our smooth muscle. We've got more elastic fibers here in the external elastic membrane. This kind of creates a sandwich for our tunica media. And then lastly, we are going to have our tunica adventitia or externa, which is going to be made up of connective tissue. And here's a photomictograph of what an artery looks like in comparison to a vein. So you could see that the arterial wall is much thicker than our vein here. Now let's take a look at each different type of artery. We talked about elastic arteries a bit already, but they are also called conducting arteries because we're really trying to conduct that blood away from the heart and toward the major areas of the body. So they will have the largest diameters, high pressure in them, and will fluctuate between systolic and diastolic. But we do see within this type of artery that we will have a lot more elastic fibers. So an example of this again would be the aorta. Now with our muscular artery, these are also called medium arteries. We still have quite a bit of smooth muscle, but we're allowing the vessels to regulate our blood supply by doing vasoconstriction or vasodilation. The thickness of the walls here are about 25 to 40 layers of smooth muscle. And we can also call these distributing arteries because they're really going to go and distribute to a particular area. For instance, I mentioned an example of a muscular artery is the brachial artery, and that is distributing it to the area of the arm. And next we have our smaller muscular arteries, and that is just going to adapt for vasodilation and vasoconstriction. And we have our arterioles to finish up our talk on the arteries here. So they are transporting the blood from the small arteries to our capillaries. They're the smallest where the three tunics can be differentiated. So you can see in comparison of an elastic artery to a muscular artery and an arterial how much that tunica media is changing, right? Beyond that, when we do turn into our capillaries, we're only going to see this tunica intima layer. And so this is the last area that we're really able to do vasoconstriction and vasodilation. So I really like this image at the very top here that shows you the transition from an arterial where we see that smooth muscle to a capillary and when it disappears. Next, let's talk about our capillaries then. So our capillary wall, as I said before, will really be made up of that tunica intima. So we have our endothelial cells, which are simple squamous epithelium, our basement membrane, and a delicate layer of connective tissue. Scattered throughout here, we are going to have our pericapillary cells, and these are fibroblasts, macrophages, and undifferentiated smooth muscle cells. We will see that our substances will move through the capillary through diffusion. And that's why we want these endothelial cells so thin, so we can easily move things back and forth. Our lipid-soluble and small water-soluble molecules will go through the plasma membrane, whereas the larger water-soluble molecules pass through the fenestra gaps between endothelial cells. Now in this image, we don't see that, but let's take a look at the next slide. So in this slide here, we're going to take a look at the three different types of capillaries. I know you probably didn't think there were three different types, but there are. There is a continuous capillary, which is similar to the picture we saw before. There really aren't any gaps in between here or fenestra. So this means these cells are tighter together, so we really are not allowing permeability for the larger molecules to move through in and out of our blood. So examples would be areas like our muscle, our skin, lungs, and nervous tissue. Then we've got our fenestrated capillary. You can see all the little fenestrations in here. They are basically pores, and we've got a lot of them. And we're going to see these where the cytoplasm is absent and the plasma membrane is made thin so that the tissue between them can create a porous diaphragm, and I think this is better illustrated in the next slide. So because we have these fenestra, even with or without a diaphragm, it's going to be highly permeable. We're going to allow substances to move back and forth between the blood. So areas that we see this will be in the intestinal villi, the ciliary process of the eye, the choroid plexus, and the glomeruli of the kidney. So last type is going to be our sinusoidal, and these will have a larger diaphragm with large fenestra. So we will see that we have a lot more permeability here, and we find them in areas like our endocrine glands, such as the adrenal medulla, where we have larger molecules crossing their wall, the liver, bone marrow, and the spleen. And here's a great image that really shows us the structure of the capillary walls. So we see here the continuous capillary where there's no gaps. Fenestrated capillary, we can see the pores here, and sometimes they have a diaphragm, other times it's not there. And lastly, our sinusoidal capillary, where we have much larger fenestra or much larger pores. Next, let's talk about how the blood flows through the capillary. So blood is moving from the arterial, and where we have capillary beds, we'll see a connection through what's called a meta-arteriole. That then works through the capillary bed, and the blood can go all throughout the bed, or it can travel through the thoroughfare channel all the way through to the other side. The smooth muscle in our arterioles and the meta-arterioles and what's known as these precapillary sphincters will help to regulate the blood flow here. So let's take a look at how those structures work together to do this. When we have true capillaries, we can make actual exchanges within our tissue cells. So what that means is that we can either contract these precapillary sphincters and cut off this route out here and allow blood to move through in one direction. This is also known as our vascular shunt, where the arterial is basically directly moving through to the venule, or we can see in this picture over here where the precapillary sphincters are relaxed and we are able to move blood flow throughout the entire capillary, and in that way we're able to make more gas exchange within the tissue. So this area is where we would have our true capillaries, whereas without it we would have that vascular shunt or the meta-arterial thoroughfare channel. And here's another great image depicting that for you. A true capillary with the sphincters open, and here the sphincters are closed where it just flows through that channel. This is also known as an arteriovenous anastomosis. And now let's discuss the veins, or starting with our venules. So these are going to drain the capillary, and they're only really made up of our endothelial cells with a basement membrane and a few smooth muscle cells. And the diameter will increase as we move through, and then we'll also see the smooth muscle will increase along with it. Once we move into our small veins, we'll see more smooth muscle cells that will form a continuous layer like we see over here. And then we add the tunica adventitia, which is made up of our cartilaginous connective tissue. From there, we move into our medium veins that are going to go between our small veins and the large veins. And you could see how the transition of tissue takes place as we go from our venule to our medium-sized vein and then into our large vein. You can see that the tunica externa is what is largest when it comes to our veins, whereas the tunica media is thin with our endothelial cells, and we don't have a lot of connective tissue and just a few elastic fibers in there. And our tunica media is going to be circularly arranged, just as we saw with our arteries. Now, what's unique about our veins is that we have valves, and valves are going to be found in the veins that are greater than 2 millimeters in diameter. We will see that the tunica intima will fold in to create these two flaps that overlap, so that when blood tries to pull back down due to gravity or something like that, the valves will pull up and close. And because of gravity, we will see that we have more valves within our lower extremities than our upper extremities. And I've pointed out some of the differences between our arteries and veins in the previous slides, but this is a really great table that kind of puts it all together for you. So I would use this as a review for your exam. Now for a clinical application on edema and varicose veins. When we have excess tissue fluid around our cells, that is going to lead to edema, also known as swelling. This usually occurs because we have too much pressure in our lower veins of the body, which causes that fluid to start moving back into our tissues, and we're not able to reabsorb it back into our circulation. This tends to happen because someone has hypertension, heart failure, a severe protein deficiency, or renal failure, and to treat it is to treat the underlying cause. When it comes to varicose veins, this happens because the veins have defective valves, and that allows the blood to accumulate within the veins themselves and leads to distended and twisted veins in here. This may accompany edema because, like we said, we have too much fluid accumulating. So the treatment would be to use support hose, elevate the feet and the legs, do laser surgery or conventional surgery. Unfortunately, people who have varicose veins do have a greater risk of developing a thrombus or a clot. Now, our veins are also known as our blood reservoirs, and that's because they have great vascular compliance. Vascular compliance is the tendency for the blood vessel volume to increase as the blood pressure increases. So if we look at this graph over here, We can see here is our intravascular pressure, the pressure inside our arteries or veins, and here's intravascular volume, the amount of fluid that we contain within these vessels. So you could see with our arteries that we aren't able to contain a ton more volume, but we are able to increase pressure, whereas with our veins, we can keep that pressure low, but contain a lot more blood within that vessel. So it's more easily going to allow for stretching in that vascular wall, and that leads to greater compliance. The venous system has a large compliance, about 24 times greater than the arteries. So that's why we call it the blood reservoirs. And here you could see a distribution of the blood flow amongst our veins and arteries. And just a quick career connection here. With vascular surgery, we're going to see it's a specialty in which we have a physician that's dealing primarily with diseases of the vascular portion of the cardiovascular system. A vascular surgeon is going to be a physician who performs vascular surgery. Completed medical school, they did a 5-year surgical residency, and then had a 1 to 2 year of a vascular specialty. We've got vascular technicians as well. This is a specialist in imaging technologies that provides information on the health of vascular systems. And sometimes these technicians and surgeons work together in the OR. And this will overlap with cardiovascular technology.